Greetings to Doctor. We are member from Group 46. Our topic for today is a study on level of awareness of child abuse issue in Malaysia among USM students. According to World Health Organization (WHO), child abuse is physical, sexual, emotional mistreatment or neglect which may cause death, injury, physical or emotional harm of children done by a person who have legal responsibility over them. Child abuse issue has become a serious global issue over these few decades. It has become a phenomenon that no longer being ignored by various stakeholders. Even though federal government have taken many initiatives to prevent the occurrence of child abuse, the statistical data shown that the cases related to child abuse are spiked dramatically all around the world, including Malaysia.
Good morning, Dr. Sayuti. My name is Ng Wei Tong. Now I'm going to present on the research objective of this research. The first objective is to review the contributing factors of child abuse in Malaysia. The second objective is to review the level of awareness of child abuse issue in Malaysia among USM students. And the third objective is to survey the opinions of USM students on the possible solution to reduce child abuse in Malaysia.
I'm Liu Xiao. I'm going to talk about Chapter 2, Literature Review. There are mainly 5 types of child abuse happening around the world, which include emotion child abuse, which is abuse of feeling of the child, fetal abuse, which is abuse of unborn or newborn baby, child neglect, which does not provide essential need to the children, physical child abuse by hurting them physically, and sexual child abuse involving children in sexual activities. Child abuse brings several impacts like mental health issue during development of the child, eating disorder like low self-esteem who feel meaningless in their life, behavioral change towards negative thoughts, as well as the most common physical injury after being abused. Thank you. In US, there are almost 20 children being abused every year and total of 27,000 calls for help each year. In Malaysia, there have been a drop of abuse cases in Malaysia, but the most cases are sexual child abuse.
Good day, Doctor. I'm Wei Jie. I will now present about the literature review for the contributing factors of child abuse. After reviewing the previous studies, we identified a wide range of factors which can be categorized into 4 groups, namely individual, familial, community, and societal. Under the individual, which is the child category, there are 4 factors including child disability, child misbehavior, child exposure to domestic violence at home, as well as unplanned pregnancy. Next, there are 5 factors under familial category, which are mental illness, criminal behavior, substance abuse by parents or caregivers, teen parents, and lastly, adverse childhood experience. Move on to the community category. There are 5 factors including living in dangerous neighborhood, lack of access to recreational facilities, violence in community, lack of law enforcement, and low socioeconomic status. Lastly, under the societal factors, there are social isolation, poverty and unemployment, society ignorance, as well as inappropriate education system.
Thank you, Wei Jie. Good day, Doctor. I'm Hon Yin. For a solution to reduce child abuse, they are classified into 5 groups, where the first group is parents. Parents should put effort on understanding their children's needs, actively join some support and training program for better parenting skill, practice good self-regulation and self-control before disciplining their children, create violence-free zone in home and seek for medical support in case having any mental disease. Next category is the education institution. The solution are to conduct proper sexuality and gender equitable education and child protection seminar in school. Furthermore, schools should have abolished the violence disciplinary system too. The third category is the government and private organization. The solutions are to set an effective legal protection framework, form social support system to reduce financial insecurity of poor family, as well as implementing home visitation programs. Next, the society can help to reduce child abuse by recognizing the warning sign of abuse and be brave to report abuse to the local police department. Lastly is to volunteering in some local child abuse prevention program. For mass media, setting age restriction for inappropriate content and publishing related news and articles can help to raise the awareness on child abuse prevention.
As an introduction to research methodology, we have determined the rate of awareness regarding child abuse issue in Malaysia among USM students, factors influencing child abuse in Malaysia, and appropriate solutions to reduce child abuse rate. We'll be introducing the content of research methodology as such. First, we will introduce research process, then followed by research approach, literature review, sampling and population, sampling size, response rate, design of questionnaire, and finally data collection and analysis technique. During the research process, first we will select the research topic, and then we will identify the problem statement, then indicate the research objective, then we will follow by review of literature, then we will select research approach, then prepare questionnaire, and then finally data collection, analysis, and report writing. The research approach we took in this study is quantitative approach. It minimized the effect of prejudice by covering large number of participating topics, ensuring reliability and accuracy of data, cover large sample population within large demographic population, and it allows multiple respondents participate at the same time. For literature review, it is an integral part of research process. It provides a basis of justification for research conducted, and it complies and evaluates existing research. For the literature that we have reviewed in this topic, we have reviewed type of child abuse, statistics of child abuse case in Malaysia, and impact of child abuse.
Now, I will be talking about the sampling and population. The target population in this research are the students from the USM main campus. The ideal sample size required to achieve 95% of confidence level are 380 responders, according to the result obtained using SurveyMonkey software. Until 8th of January, the researchers only received 202 questionnaire survey after sending Google Form link to all the students from the USM main campus. The questionnaire survey consists of 4 sections, which are general information about the responder, USM student awareness, contributing factors, and the opinion of USM student on the possible solution to reduce child abuse in Malaysia. In this research, a questionnaire survey technique is chosen to obtain the primary data to cover large population in USM main campus. The frequency and percentage distribution has been used, and it is displayed as bar graph or pie chart in analysis and finding. That's all for methodology.
Based on the analysis and finding the awareness on child abuse issues in Malaysia through Google Form, we found that there are 97.5% of respondents heard about child abuse issues in Malaysia. And then there are 97.5% of respondents think that the awareness about child abuse among USM students is important. Furthermore, most of the respondents, which is 98.5% of respondents, get the information about the child abuse issues from social media, and also 95% of respondents didn't experience the child abuse before. Analysis and finding based on the factors that cause child abuse in Malaysia. Most of the respondents think that familial factors is the most contributing factors that causing child abuse in Malaysia. From the individual factors, we found that most of the respondents think that children exposure to the domestic violence or intimidate partner violence is the most individual factors that cause child abuse in Malaysia. From the familial factors, most of the respondents think that teenagers' parents is the most familiar factors that cause child abuse in Malaysia. And next, for the community factors, most of the respondents think that lack of law enforcement is the most community factors that cause child abuse in Malaysia. Lastly, for the social factors, most of the respondents think that poverty and employment is the most society factors that cause child abuse in Malaysia.
Reading to Total Society, I am Lee Jie Liam. Now I am going to talk about analysis and finding for solution to reduce child abuse in Malaysia. Through the survey, most of the students are agreed that the solution to reduce child abuse in Malaysia through education is conduct child protection seminar and program to enhance children's self-protection to keep them safe. Besides, most of the students agree with that this good self-regulation is the primary solution to reduce the child abuse in Malaysia to parents. Therefore, parents should get control of themselves before disciplining their child and avoid physical punishment. Next, most of the students agree that solution to reduce child abuse in Malaysia to government or private organization is form a social support system to help the low and medium income families to receive financial support. Other than that, most of the students agree with published article and advertisement to rest on children protection is the solution to reduce the child abuse in Malaysia to mass media. Lastly, through society, most of the students agree that recognize the warning sign and caring towards surrounding people is the primary solution to reduce the child abuse in Malaysia. The society must be alert to the surrounding and be brave to report to the authority if noted any suspected child abuse. Thank you.
As a conclusion, we can conclude that child abuse is a significant issue that happening not only in Malaysia but all around the world. So, in this research, most of the USM students are aware and knew about the child abuse issue in Malaysia, and most of them agree that the major contributing factors of causing child abuse is the family factor. Besides, the possible solution to reduce child abuse issue have been identified in this research from different perspectives in order to ensure the achievement of aim and objective of this research. Therefore, hopefully this research is able to raise the awareness and improve the knowledge of public in order to reduce the cases of child abuse happening in Malaysia.
Thank you, Wei Tong. In order to create awareness among all the USM students on child abuse issue, it is recommended at USM to organize campaign and talk annually as an effort in building a violence-free society as an educator. Next, they should provide free clinical psychological consultation to all the USM students and staff by setting up a department which consists of a team of certified clinical psychologists. Lastly, they should incorporate with NGO and government to provide support to all the child abuse victims among all the USM students. For the limitation of the study, first will be the time constraints as the data collection was only 1 month. Therefore, the data collected will not wholly represent the opinion of all the USM students. Next is the respondents' statuses and also their perspective. As most of our respondents are students that are single and not married, therefore their responses and their perspectives were most likely at the side of a children in a family rather than a parents. That's all for the presentation from Group 46. Thank you and have a nice day.